Right now, 300 million people are suffering from depression worldwide. 1 out of 100,000, 1 in 100,000, that is the ratio of psychiatrists to the population in low-income countries. Another statistic is that by 2030, mental health problems, including depression, anxiety, schizophrenia, will be the leading cause of mortality and morbidity in the world. Depression is the leading cause of disability worldwide, and mental illnesses and cardiovascular diseases are the top drivers of lost productivity. And finally, suicide is the second leading cause of death amongst the youth aged between 15 and 29 years, with 79% of suicides occurring in low and middle income countries.
Where we come from, we thought, or we were brought up knowing that mental health and depression is for rich people. It's not our disease.
Psychologists are needed everywhere. We are needed in school, we are needed in institution, we are needed in industrial area, that is industrial psychology. We needed even in the community prison, and that is forensic psychology. Currently, attachment at Mathare Hospital, and I'm really frustrated because it's only one psychologist who is employed at that area, and most people people from other areas are only sent to Mathare Hospital. And for us, we are really overwhelmed with work over there. Burnouts are there. I can testify for the burnouts that I've experienced, I myself, and yet I haven't yet cleared. Please, it's real. It's something which is real. Kids, not only us big people that we see here, even the small children, under the 4-year children that we also experience in that places. So yeah, it's real.
Church can be a place where you're supposed to find hope, can become the place where you actually don't find it. And worse, you can't even dare to show that you're struggling. And as spiritual leaders, we need the education that helps us begin to understand that mental health is a real issue, just like physical health.
We are all human, but we need to talk about these things. And that is the beautiful conversation that has been happening in Senate in the last couple of months with the Mental Health Amendment Bill 2018, Senate Bill number 35, which I am the sponsor. The bill is very wide. Actually, the bill first brings the old bill into the new dispensation. So we have the national and county government roles and responsibilities that are clearly defined when it comes to mental health. One significant new change that has come in is the fact that we want to streamline mental health into the health system. So rather than have freestanding mental health institutions because of stigma, we want mental health to be infused into the health system. So you can walk into any hospital and you will be able to get services of a psychologist and whatever.
Community mental health is the way to take it. If you look at the issue of suicide, it's not even taken up from an individual space like ours in any other working health system. It is a community issue because it is supposed to bring in the education system, you've got the church system as support network, or whatever other traditional systems that sit in place that allow for advocacy to happen. But like anything else that is outside the mainstream, is how do we bring it into everyday conversation? So this needs media, this needs our government to really be, they're the number one agent. Because this is tier 1 all the way down. It is done with all the people out there who are saying, we're going to make it so common that you're going to be talking about it like bread in the morning. That's just how you're going to be talking about this. It's the only way to do this. And why do you think men are the ones who have the highest suicide rate? Men will always use more violent and more final methods. Women use softer methods. And that give them more opportunity to come out. So women will always be higher in statistics of suicidal attempts. Men will be violent, guns, knives, hanging, and it'll be more final. But what we do know, and that's another myth we need to really be sure of, that at that time, in that moment, Most people believe it's taking away the pain. It's the method that means that they're not going to be saved. Is they just want to take the pain away. And it's extreme levels of pain. So it will be in situations where the average person does not perceive. And this is how so many people who commit suicide, most people will not know. And there would have been no indication. And so if you don't dig a little further, if you don't go deeper than just what is at surface level, then it's very difficult to see who is at risk. What's going on in their lives? Does there seem to be some kind of stressor? It could be a chronic illness. People who've had debilitating diseases like spinal injuries, things that have made their lifestyles shift so fast that they cannot cope with their change of status, the change of who they are at risk.